what is one of the more common causes of fatigue? Poor sleep. Now, here's 6 different scales that if you're so inclined, you can look at these scales, these questionnaires, and kind of quantify how much of an impact poor sleep has had on a person's quality of life, or their functioning. Well, okay, I mean, helpful if you see a lot of these patients or want to do an outcome study. But in primary care, I would struggle getting people to fill out a 22-item questionnaire when all they're saying is, I'm just pooped, help me, right? It's making it difficult for me to function well, and so forth. So really, we tend to rely much more on a sleep diary. That is, tailor the assessment to that person's situation. Quantifying it may be less of an issue because, in fact, the goal of doing a sleep diary is not to increase the number of hours of sleep. It's instead to increase sleep efficiency. Sleep quality is what matters. So once you find this, or there's different behaviors that are performed, you can then target and say, okay, how might specifically strict sleep restriction, stimulus control, and sleep hygiene actually benefit this patient? So again, the question comes down to what I'm going to share with you now, what will be different for you next week? Now I've got to give a shout out to Dr. Sonia Ancoli Israel, who is an internationally renowned expert in sleep medicine. She just happens to be a colleague of mine in the Department of Psychiatry at UC San Diego. And she allowed me to use the following 4 or 5 slides to demonstrate some important concepts here. So it's a consensus sleep diary, the core elements. The Association Society of Sleep Medicine leadership got together, and these are the 9 elements that are critical if you're going to try and help a person improve their sleep quality. So what I want you to do is find a white space in the outline, that's some handout or something, or maybe if you brought a pad of paper with you. What I want you to do is the upper left-hand side of that white space, that sheet of paper, is simply write down the words, time into bed. And then write a line. That's your first row. The next row is going to be titled, time tried to sleep. And you can see on this slide, those are really the only 2 things you can complete in a sleep diary before you fall asleep. The other 7 things are things you're going to estimate the next morning. Okay? The third thing you look at is time to sleep onset. How long after lights went out did it actually take you to fall asleep? And then also record or estimate the number of times you were awakened throughout the night. You total up the time that you were awakened. For this example, this is actually a patient I've seen recently. She was awakened 3 times. First time for 20 minutes, second time for 25 minutes, third time for, I think, 30 minutes. So when you totaled it up, she was awake for 75 minutes. And then the final awakening time. For most of us, that's when the first time the alarm clock goes off. Below that, however, you put the time out of bed. Maybe you're one of those people who hits the snooze alarm 2 or 3 times. And then finally, what was the quality of your sleep? On a scale of 1 to 5, 1 being lousy, very bad, 5 being excellent. And finally, some space for comments. Here, this one would put down, she had wine with dinner and she was watching the Olympics. That was relevant, as you'll see when I share with you her story. Now, for here, this is an extremely bad night where sleep efficiency is 58%. You can see on the bottom. The guidelines say if your sleep efficiency is 90% or higher, there's probably relatively little you can do to improve the quality of your sleep. That is the marker, 90%, because if it's lower than 90%, chances are there's some things we can help you to improve the quality of your sleep. And that's a marker to say what we're doing actually is working. Now, to actually calculate sleep efficiency, the denominator is easy. That's simply how many minutes were you in bed. So you go from 10:30 at night here in this example to 7 o'clock in the morning, 8.5 hours, now you calculate that out, and that's 510 minutes. That's your denominator. The numerator is a little more complicated. Because the first thing you have to calculate in the numerator is how much time was between when you tried to fall asleep, here 11:35 at night, and what time you finally awakened, which is at 6:40. Now that, the total number of minutes between 11:35 and 6:40 is something like 450 minutes, perhaps. Okay. But then, that's not the total time amount you were asleep. You also took 55 minutes to fall asleep. So from that 4:30, for example, you subtract 55, and as well as you subtract another 75, because she was awake that much throughout the night. That is then your numerator, and I think it's like 390 minutes over the 510, and you get your sleep efficiency. Again, this is the marker in sleep medicine to understand, is there a chance to improve sleep if we think sleep is a factor in creating fatigue? And is what we're doing making a difference in improving fatigue?